Thanks everyone for joining today's webinar, Why HIPAA Compliance Isn't Enough to Protect You from Data Breaches. My name is Vladimir Negron. I am the Senior Product Marketing Manager here at Mend, and I have the privilege of joining JD McFarland. JD, how's it going?
Good. How are you doing today, Vlad?
Great. JD's our solutions architect, been with Mend for quite a while, making sure everyone at Mend and its customers remain secure. So thanks for joining us in this webinar. Just a reminder for everyone, the webinar deck and the recording will be sent to anyone who's registered tomorrow with the email that you provided. So no worries if you can't take detailed notes. We'd rather you engage with us, chat. If you have any questions, put those in the Q&A. With that, let's go through today's agenda. A few things to cover here. We're going to start with the staggering impact of data breaches, then flow into a brief history of healthcare privacy laws, the benefits and risks of care in the digital age, tools for a secure digital care program, and we'll finish it off with a question and answer portion. Again, as we're going through, if you have any questions, feel free to use that fancy Q&A box at the bottom of your Zoom app, and we'll answer those at the end. So let's get started. The staggering impacts of data breaches. JD, a lot to cover here. Why don't we start with why healthcare is such a target for cyber attacks and data breaches?
Sure. The first answer is because we make a really good target. We have what they're looking for. It might surprise the folks on the call to know that on the dark web, your identity is only worth about $2 to malicious actors. However, when you look at the amount of data that healthcare has, say you're a mid-sized hospital, you could potentially have 500,000 patients' data in your systems. At $2 a pop, all of a sudden, that's a pretty nice payday. Add on top of that, we have a lot of distributed entry points into our healthcare data systems, which make us more vulnerable to attack. We also have lots of staff make us vulnerable to social engineering attacks. So not only do we have a lot of valuable information, we're fairly easy, and we don't have the kind of budgets that finance and government has where we can protect from nation state level attacks because we have a whole 3-letter agency somewhere devoted to protecting us. So we kind of hit all the right boxes for a cyber criminal to go after.
There are quite a few different boxes, and that starts bringing us into some costs associated with data breaches. JD, there's a few unknowns, and we'll get to those in a second. But let's start with one of the greatest knowns, the fines associated with data breaches.
Yeah, HIPAA spells that out. That's one of the easiest costs to understand. You're looking at up to $50,000 per violation for the organization and up to $250,000 with 10 years in prison for individuals. What's important to understand here is that per violation does not mean you have a laptop stolen, it has 4 million clients on it. That's not one violation. Every piece of PHI is its own violation. So name, date of birth, social security number, address. All those are each independent violations multiplied by the number of participants, which is why you see some of these HIPAA fines getting so huge. On the flip side, we also forget that individuals can be fined and even imprisoned for HIPAA violations. Now, typically that happens when individuals leak protected health information about people like celebrities and things like that, but it can be applied to someone, something as simple as a grandmother working at a behavioral health practice and looking at the treatment information of her grandchild. So it's important to understand this applies to everybody, and it can be very costly in all these situations.
Let's talk a little bit about some examples of some of these settlements and fines, JD. We have Anthem and Advocate here as some examples. Talk a little bit more about those.
Sure. Anthem was $16 million, and that was the settled amount, which means they were actually liable under the HIPAA statute for even more. Advocate was $5.5 million. And the Advocate one is a pretty good example of a relatively small incident being very, very expensive. They had 4 laptops that were stolen from the office. They were unencrypted. Doesn't matter how many devices were stolen, how big the physical hardware theft was, there was 4 million people's information on those laptops. That's a huge impact. And it just goes to illustrate why we have to be careful about every aspect of our infrastructure, our software, and basically plan for how we're going to address these risks. It's also important to note, just because the big guys have these big numbers doesn't mean that there aren't smaller fines that hit the much smaller small practices throughout your communities. One really good example, and something I'm going to hit on a couple different times throughout this presentation, there was an example of a small practice that had a eFax vendor that was not HIPAA compliant. Someone filed a complaint, it was investigated, and they got hit with a $31,000 fine. Potentially, it's a lot easier for Anthem, who's a billion-dollar health system, to absorb a $5.5 million fine than it is for a small mom and pop practice to absorb $31,000. So this hits everybody. We're all impacted. We all have to look out for it.
Yeah, that's a perfect example, like you said, of hitting everyone, right? It doesn't matter if you're a large organization or if you're not as large. There are just many different ways if you're not following the proper procedure. So that covers the fines portion, some of the knowns or the JD. Let's talk a little bit more about the unknown costs associated with data breaches, starting off with lawsuits and ransoms.
Sure. As you mentioned, fines are known. Everything else, it's kind of a guess. You don't know what your liability is going to be. Ransomware is very big in the news. We get hit with it all the time. Not only is it, you're basically at the mercy of the people who are holding you ransom, they also want that money right now. The government's at least nice enough to let you come up with a payment plan as part of the settlement agreement. The ransomware folks are going to want their Bitcoin next week. So you don't have a lot of time to make a decision. You got to come up with it, and that's going to hit your balance sheet now. Lawsuits, they take a little bit longer, but boy, can they be expensive. And it's very, very hard to predict where those are going to come in.
And this last one, lost revenue, this is something that we don't always consider, right, JD? But from a large healthcare organization to your average healthcare practice, this may be some of the most impactful costs associated with data breaches.
Absolutely. Think about what we've seen in 2020. We saw the push to largely telehealth, but more than that was the consumerization of healthcare. Because people can, in many cases, pick and choose their providers now, they have the ability to vote with their pocketbook. And ultimately, if they have 2 providers to choose, one who's had a very public data breach and one who hasn't, they're going to go to the people they're confident are going to protect their data. So your reputation now is more important than it's ever been. In long term, that lost revenue aspect may be the biggest impact out of all of these.
Thanks for that, JD. I know there's a lot of costs associated with it. We've covered the knowns, some of the unknowns. Let's cover now in a brief history some of the healthcare privacy laws, that the fines that we were discussing earlier. Where do they come from? If we're looking at it from a timeline standpoint, going from earliest to most recent, we have the well-known HIPAA, or Health Insurance Portability and Accountability Act in 1996, followed by COPA in 1998, the e-sign Act in 2000, the HITECH Act in 2009, and the final omnibus rule in 2013. But if you're looking at it as a whole, a lot of people would recognize HIPAA, but fewer, if not maybe no one on this webinar may recognize the final omnibus rule. Can we start breaking these down a little bit, JD, so that everyone understands the importance of them and why they were enacted in the first place?
Yeah, and for the folks listening, you don't have to go ahead and go to sleep. I'm not going to spend more than a few seconds on this because it gets really boring. But of course, everybody knows what HIPAA is, and that's what basically established the general guidelines for protecting protected health information. It's really old at this point, and it's been updated through the years. A really good example is that one of the only security methods that HIPAA specifically endorsed is cover sheets on faxes. So as far as HIPAA is concerned, a fax with a cover sheet is as secure as AES 256-bit encryption. That gives you some idea how outdated the law is. And it's also part of the reason we're still stuck dealing with faxes all these years later, because until someone fixes that, faxes are perfect as far as HIPAA is concerned.
It's not the same thing, JD?
Yeah, no. I have a dream, and one day that's going to be there's no fax machines.
Oh, that would be nice. We wouldn't have to listen to those annoying sounds when you dial into the fax number incorrectly.
Exactly. Another law that is often not thought of, but now that we are in this new digital health world, is COPA. And COPA is designed to protect children on the internet. It was originally devised back when things like America Online were out and children were going to chat rooms and they were doing e-commerce and people were getting scammed and children's identities were getting stolen. Well, guess what? We're in the e-commerce business now as healthcare, and we work with children. So any of the digital health solutions you work with, they need to be COPA compliant. It's not enough to just be HIPAA compliant. They have to worry about COPA too. And there's a whole set of rules and regulations that go along with that. Federal e-sign Act. This is actually my favorite one on the list because it's what has enabled a huge portion of the modern digital commerce we see today. This lets you sign contracts and other legally binding agreements with a digital signature. It is applicable to healthcare. And there is a lot of state regulators who don't like to think about that and pretend to ignore it. But the actual law in the United States is that you can use electronic signatures for healthcare purposes. And it all goes back to this 2000 era law. HITECH Act was designed to further update and modernize HIPAA. Basically, the most important takeaways for this is it establishes the concept of electronic PHI, which is most of what we're talking about now. And it extends the HIPAA protections originally designed for mostly physical records into this digital space and has rules and best practices designed around that. And then finally, the one no one outside of a few nerds like me knows about is the HIPAA amendment via the final omnibus rule. Omnibuses are these bills that Congress passes where they build bridges to nowhere, name roads after politicians, and update federal regulations that no one reads. But it was really, really critical because it established the notion of the business associate agreement, which is where we've seen a lot of HIPAA fines levied. And the business associate agreement is what requires any of the people you work with, any of the other agencies or vendors who you are sharing information with, to protect that client's information. And it's absolutely imperative that any vendor you pick for a digital health solution is willing to enter into a business associate agreement with you.
Yeah, JD, I take that to heart. It seems like an obvious thing, but perhaps some of us may not even be aware of the need for BAAs. We wanted to get a sense of our audience. So I'm going to launch a poll for everyone right now. So we want to understand and inform everyone after we get some responses. Does your organization have a BAA or business associate agreement for any vendor that has access to PHI or patient health information? We'll allow everyone to go through, answer, and we'll come back to it, JD, later, and you can talk more about the importance of BAA, especially if people don't even know if they have a BAA right now for some of these technology vendors. Let's now move over and talk about the benefits and risks of care in the digital age. We're now in the 21st century. There are a myriad of ways of communicating with patients. There's many different types of technologies. There's many different types of tools available to us, JD. Can you speak a bit to their differences? Are they even equally committed to security?
Yeah, absolutely. And this is a good time to think about another aspect of everything we're talking about. We, to date, have talked about the importance of all these security tools for the benefit of the practice, but it's also important to remember we are dealing with people when they are not in the best points in their life. They're coming to us because they need help, they're sick, they might have mental health issues, and we don't want them to suffer because of a lapse of security on our part. The last thing you need to do to a severely depressed client is let their identity be stolen and end up ruining their credit. It's not going to make any health outcome any better. The great thing with all these tools on the slide today is that they offer ways to improve care, improve the experience for the consumer, and ultimately empower providers. But they all have risks and they all have different considerations that we need to think about. So first off, patient communication tools, things like text and email reminders, secure messaging with clients, instant messaging. These all have a whole myriad of risks associated with them. A couple right off the bat. Everybody wants essentially two-way texting. They want to text with their clients just like they text with their significant others and their friends on their phone. That is not HIPAA compliant. As soon as you put PHI into a text message, it is insecure. It's a violation of HIPAA guidelines. You cannot get a BAA from every cell phone provider out there to agree to protect that information. So that avenue is cut off to us. A lot of folks talk about two-way texting in healthcare, and what they actually mean is secure instant messaging. And in those scenarios, if you're using one of those providers, once again, they have to offer a BAA. They have to enter into that agreement with you. Tools like Facebook Messenger are explicitly not for healthcare use. It is directly in their terms of service. I have seen healthcare organizations embed Facebook Messenger on their website for communication with clients. That is going to cause problems for you. We've kind of been in the wild, wild west in the past year. A lot of emergency orders have kind of stopped the enforcement of HIPAA and privacy laws. Those are expiring. They're all coming back. So if you're using one of those tools that's not secure, look for tools that are. We offer great tools that can replicate that functionality in a compliant fashion. Video visits, that's kind of been the star of digital healthcare in the past year. There are HIPAA compliant platforms that are going to protect you, offer security to the customer. They also offer the ability to put actual clinical treatment tools and workflow optimizations right there at the hands of the provider. But they're not free like Zoom. But guess what? The free version of Zoom is not going to give you a BAA. It's not HIPAA compliant. And yeah, you might save $20 or $30 a month, but you might also get hit with a $50,000 fine. So definitely something to keep in mind. Digital record keeping. We all more or less hate our EHRs, but we're increasingly stuck with them. And these are ultimately the targets that hackers are desperate to get their hooks into. That's where all that tasty PHI lives. But also that's where all these really cool tools integrate with. And if they do not meet the right security standards, all you're doing is opening up and exposing all those tasty patient health records to the bad guys on the internet. So anybody who can offer you integrated solutions, that's great. We want to optimize the provider experience wherever possible. But if you're doing it in an insecure fashion, you could be looking at a $5.5 million fine. Very, very expensive, lots and lots of risk. So as you are vetting those partners you choose to work with, you need to be very, very careful.
Yeah, JD, when we'll get to in a second talking about some of those standards you were just alluding to, but let's start off with why it's so important to secure these healthcare business associates. Let's use Zoom as an example, right? We think, hey, Zoom is great at conducting virtual meetings. Why don't I use it to meet up with my patients? Why don't you tell us a little bit about what Zoom recently encountered?
Yeah, Zoom got caught lying about being encrypted, and they're paying for it. They lost a bunch of users. They do now offer a BAA in a HIPAA compliant tier, or so they say. It's HIPAA compliant, but that costs money. That's not in their free tier. The necessary steps it takes to properly secure patient data in transit and at rest cost too much to give away as a free service. So first red flag, is it free? If it's free, it's probably not going to be compliant. There's an old saying on the internet, if you're not paying for it, then you're the product. So if you're doing it for free, they're selling your data. And if they're selling your data in your healthcare practice, that's a big problem. So there's different steps you can take to make sure that you don't use a non-compliant tool like Zoom. And we're going to talk a little bit about that.
Yeah, let's jump in. JD, what should we be looking for when we're evaluating these technology vendors? They're not all going to be the same. What are some of the key differences that we should be looking at?
Sure. Number one, ask for a BAA. If the salesperson from that organization does not know what a BAA is and cannot immediately answer, yes, we will enter into a BAA with you, they are not a healthcare vendor. Move on to the next one. That's going to save your time, and ultimately it's going to save you some problems. The next thing, are they high tech compliant? Not just HIPAA, but also high tech. Additional security guidelines came out. They need to abide by them. Once again, if you're not talking to a healthcare vendor, they may not know. They may be totally foreign to them. If it's someone who's comfortable working with healthcare, they're going to say, absolutely not a problem. And finally, and the most important, is any third party actually verifying what they're saying? The root cause with Zoom is that they were lying. They said they were encrypted. They weren't. What Mend has done and many other reputable companies do is they pay a lot of money to third-party auditors to go through and validate the security and controls in our environment, the way we roll out software, the way we do what we do, because it's not just a matter of flipping a switch and turning on encryption and you're secure. If you're using the default passwords on everything in your organization, well, you're going to get hacked and your security is meaningless. So these are very intensive, time-consuming, and rigorous processes that reputable organizations are going to go through. And one example is a SOC 2 audit. Ask your vendors for a copy of the audit results or a summary of the audit results. If they can't provide that to you, ask them how you are supposed to validate that they are doing the things they're saying. 9 times out of 10, they're not going to have a good answer. And if they're not willing to go on the record with you and your security team and actually go through what they're doing to protect their environment, which is ultimately where your data and your patient's data is going to live, they're not worth your time because they're not a serious vendor and they're probably going to jeopardize your patients.
A lot of what I'm hearing, JD, seems to go back to transparency, right? Yes, it's important to be secure, but are they being transparent? Are you able to ask them these questions and are they correctly answering them? Have you been finding that a lot of vendors out there are transparent with these kind of answers, or is it more difficult to get what you
They're
need from them?
increasingly becoming more transparent. But as I mentioned, it's expensive. So if you've got a startup who's essentially fly by night and they're trying to convince you that they're bigger than they are, they're not going to spend the tens of thousands of dollars necessary to go through a SOC audit. It's going to essentially eliminate them out of the box. You're also going to see large legacy vendors who know they have major issues in their environment and don't want to talk about it, who are not going to be willing to get these audits, and they're certainly not going to share the answers. So it helps really identify the kind of parties you want to work with.
That makes sense. And going back quickly to BAA, I just want to loop back to the poll that we put to everyone earlier. Does your organization have BAA for any vendor that has access to PHI or your patient health information? So of the responses, JD, you'll be happy to know 70, a little bit above 70% answered yes, but we do have about 30% who answered, I don't know. They're just not sure, right? So I think later on we'll get a bit more into BAA, but let's make sure we talk a bit more about why it's so important, and how people can start asking and getting the BAA if it's so necessary. Let's quickly though turn over to some tools for a secure digital care program. There are many, JD. I know we could probably be here for hours talking about all the different ones, but we've narrowed it down so that everyone can understand some of the key ones. So JD, why don't you start us off with secure video telehealth?
Yeah, absolutely. We talked about why you probably shouldn't use a video conferencing tool like Zoom. So let's talk about what a secure video telehealth solution can do. Number one, you're going to have encrypted video. Any kind of recording is going to be stored in a compliant fashion. This is something I harp on because a lot of the vendors in this space do it in what I consider to be a very risky fashion. If you allow recording, think about that data. That is probably as confidential of a piece of information you are ever going to have on a client. And if you are going to allow recording of sessions, you need to give that the highest level of protection. Over the past year, a lot of providers went home and they now work from their homes. Because of that, a lot of especially large groups, they couldn't come up with new infrastructure to support that. They had to let providers in many cases use their home PCs, do things like remote in to work their work environments, and telehealth will not work in a what we call RDP scenario for most groups. So they end up using their home PC. And if they're going to be able to download a recording to their home PC, guess what? You're liable for how that PC is secured. Is it encrypted? Are you going to be able to remote delete it if you terminate that employee? Are they downloading malicious things from the dark parts of the internet that we don't want our corporate PCs to go to? And when a recording shows up on YouTube from one of your providers because something went wrong, it's going to be a really bad day for your organization. So, for example, at Mend, the way we handle recordings is we allow the provider to record, but we push it back to your enterprise secure storage that your IT team is in full control over and controls not just retention, but access. And at Mend, we don't even store those recordings. We don't want that data. So it's a really useful tool for a lot of healthcare specialties. But if you're going to use it, you need to think through just what are the ramifications of this. Other things that we're able to do with a telehealth tool, you're able to optimize for low bandwidth scenarios so that you can actually maintain communication with clients in rural areas. We're seeing a lot of studies come out now that shows that telehealth was great for most people, but in states like Iowa, they still have 20% of their population who can't do telehealth because they can't get a good enough internet connection. a really optimized telehealth platform is going to sacrifice that really pretty image in order to maintain a connection and maintain that clinical consultation with a client. So at a high level, those are some of the things to look for when you're looking for a secure video solution.
Let's talk about easy patient access, right? JD, easy being the key word here.
Yeah, absolutely. And this goes right to passwords. We all hate passwords. And even big companies like Microsoft now have acknowledged passwords don't work. Because of that, we see a lot of EHR portals failing because they do things like require patients to reset their password every 6 months, but the patients can't reset it. You've got to call the practice's help desk and get them to reset it. And that's a burden most patients, as we mentioned earlier, they're not interacting with these systems because everything is going great in their life. They're interacting with it because they need help, they're struggling, and it just makes their life difficult. With Mend, we have a secured, patented solution where each link is unique. It's a secure link, only good for that patient and that visit. And then all they have to do is validate their date of birth. That gives us our 2 factors for HIPAA compliance. They're able to get into the session with very, very little effort. And if they need help, we have our support team available to them, both for the patient and the provider. So everybody dealing with that patient and all the tools they're using are optimized to make it easy for them to get in the platform while meeting all the compliance requirements to keep you and them safe.
Safe sounds good. Something else I heard, JD, I don't want to gloss over it too quickly. Customer service or customer support, whether it's on the staff side for the organization or the patient side, it's not going to be very likely that your Zooms of the world are going to go in and be helping a patient, or your Googles of the world going in to be helping a patient. JD, can you elaborate a little bit more about like why it's so important as healthcare organizations that the telehealth tool does not just allow easy patient access, but also easy patient support?
Absolutely. And it all comes down to no-shows. So no-shows have 2 really negative impacts. 1, it affects the practice's bottom line. And 2, the patient doesn't get the care they need. I keep harping on this, but they're not coming to us because they're having a great day. So they're trying to accomplish something with that visit. And if they can't have it, you're putting them at risk. And ultimately, if there's a technical barrier and it's not rapidly solved, at Mend, our average time to response is 13 seconds, time to resolution is 3 minutes. If you can't solve the problem within 5 minutes, that visit is likely to result in a no-show. The practice is going to lose the revenue. The patient's going to lose that consult. Best case scenario, they're going to reschedule and have it later in the day. Worst case scenario, it's going to be a week or 2, maybe even longer if they're seeing a very highly booked specialist. And unfortunately, that has significant negative impacts to care. So we want to avoid that at all costs.
Let's talk about safe, efficient data and collection and storage, JD. There's a few things to cover here. Why don't you break it down for us?
Yeah, and this comes down to integration, automation, and ultimately making people more efficient and let them do more clinical care and less paperwork. But in order to make all that work, you've got to connect to that nice, sweet, juicy PHI located usually in your EHR, which opens up massive security risks. So in order to take advantage of things like patient self-scheduling, pushing forms out to patients automatically based on appointment types in the EHR, and then pushing the answers back to the EHR, you need to work with vendors who you can trust. And that's where things like asking them for their SOC 2 audit results are really going to pay off, because this is the highest risk kind of relationship you can enter into. You want to take every precaution you can.
And not to get too in the weeds here, but this portion about securely collecting patients, I know
Payments.
Payments, sorry.
Yes.
Securely collecting payments, thank you. PCI compliance. It's not something commonly discussed, but I know that it's very important to you. Could you quickly touch on that?
Yeah, PCI means payment card industry, and there is a whole, we could do a whole nother webinar just on PCI compliance, and it's even more boring than this. But what you have to know is that if you don't follow PCI best practices, you can lose the ability to process credit cards as an agency. And there are very specific things you need to do to make sure that all the vendors you work with are PCI compliant. And you don't want to have to attest to PCI compliance yourself, because then you have to deal with auditors and very, very expensive processes. So with Mend, we work with authorize.net. We don't actually store any of the payment card information. They do. It's all they do. It's what they're good at. And the combination of those solutions means you're able to collect payments from your patients in a compliant fashion that's easy for them, and you don't have to worry about all the additional regulatory burdens that come with that.
The less we have to worry about, the better, JD, for sure. Let's cover. We've discussed a few things here, JD, and while many platforms can claim that they are a complete digital front door, few of them actually deliver. So how does Mend offer everything a healthcare organization need to stay secure, to stay HIPAA compliant, to follow all the things that we've been discussing during this webinar?
Yeah, absolutely. We offer the toolkit necessary to interact with the client in the digital space. So where a teleconferencing solution might fall short, even if they meet all the regulatory requirements, is, well, okay, you now have done a visit. How do you get paid for that visit? Or, okay, you've got the visit done. How do you get the patient to sign off, or even pre-visit? How do you get them to sign a consent to treat? So we offer all the tools necessary to interact with that patient. And in fact, for you to have an entirely virtual relationship with that patient, so they never have to set foot in your office. You never have to mail them or fax them. Once again, I use the F word, fax. Fax them an intake packet. We'll handle that, and we can do it automatically. So some of the tools we offer for that: automated appointment reminders and notifications. Through that highly secure integration with your EHR, we can automatically send them their appointments, both for telehealth and in person, and we'll automatically notify them beforehand on a set cadence, so they know when their appointments are going to happen and they're going to get reminded of them. We can capture the payment at the time they schedule, or you can bill them at any time using our tools. We give you flexibility based on your workflow. Patient self-scheduling is huge today. We talked a little bit earlier about the consumerization of healthcare. One of the biggest impacts on no-show rates we see is letting patients schedule their own appointments and letting them schedule it closer to their appointment. So our tools are designed, once again, to work securely with the EHR. It lets patients schedule based on logic you determine, using the availability of the provider that's in the EHR with additional business logic that you set in our tool, so that patients are able to do self-scheduling with guardrails, I call it. They're not free to put an appointment anywhere on the patient or provider schedule. They're going to put it in a logical place, and they're going to get filtered to the right place in a nice consumer-friendly method. Messaging, I talked about that as well. Everybody wants that easy way to communicate with customers. We offer a fully secure, patient secure messaging platform that allows them to message, upload appointments. If you're something like a dermatology practice, you can even perform an entire asynchronous billable visit using our secure messaging tool. Lots and lots of flexibility, lots of new opportunities for workflows in this digital age. Digital intake forms, already mentioned that. Our forms are completely responsive, optimized for mobile devices. Over 80% of our patients access the software on a mobile device. So solutions like DocuSign are just a pain in the butt. Giving them an 11-page intake PDF and they have to scroll, pinch, zoom, and find the place to sign, that's not fun for anyone. We take your forms, we rebuild them so they are optimized for mobile experience with conditional logic, nested questions, filters on what they're able to enter, lookups for things like pharmacies, doctors, medications. So we make their job easier. And we can even do things like calculate sliding scale fees and patient balances. So we're going to get you better information faster, and it's going to be easier for the client. As a result of all those tools, we're able to actually get over 60% of our forms completed within an hour of the time they're assigned, and over 90% come back before the time of the appointment. So really cool tools. Very excited about what we can do and the way we can actually basically take your current practice and move its workflows into the digital space, open up lots of new opportunities to bring in more clients, improve care, improve the life of the providers as well.
Yeah, that's what I'm hearing, JD. I mean, you said the F word, facts. You said the A word, asynchronous. There's a lot of things to cover, and what it comes back down to it for me is, can we help people see more patients more easier, and can we do it in a manner that they don't even have to worry about it, right? We take care of everything for them, and we collaborate with them to customize to their needs. So it's great the work that you are doing to keep everyone secure. I appreciate all the work that you do. For everyone who's joined us in this webinar, we're going to switch over to the question and answer portion. So if you have any questions, feel free to drop down to the Zoom app and put it into the Q&A portion, and we'll address those. JD, for the ones that have come in so far, let me take a look and let's cover some of these. Let's start with, is my practice liable for a vendor security breach?
Yes. And that's where the BAA comes in. Part of what that agreement does is give you some legal protections there. And I'm not a lawyer, so I'm not going to pretend to be one here. But basically, part of that BAA agreement, the business associate agreement, is everybody who signs it is agreeing to watch out for the patient. And if a vendor has a breach, they are required by that agreement to notify you, so you can in turn notify your patients. And the same is reciprocal. So if you have a breach, you notify them. This means that the whole web of vendors you use is all collectively looking out for the patient. And if you don't have that, you're not only in violation of HIPAA, but you're probably going to be facing more liability in a civil lawsuit. But I'm not a lawyer, so consult with your legal counsel before making any final legal decisions.
That was a good disclaimer, JD.
Mm-hmm.
Here's a question actually I have, since we're talking about data breaches. Has Mend had a data breach in the past?
No, we're working very hard to keep it that way. Cross fingers, knock on wood. But that's also why we have all the security processes we have, and that's why we have them independently audited. Because if we weren't doing that, it's much more likely that we're not going to catch something. By constantly going through and reevaluating how to do things better, we do things better.
What about, we talked about BAA. How does a BAA keep patients' data safe?
Yeah, as I mentioned, it basically commits all the people who are touching that patient's health records to actually work together to protect that patient's information. And probably the single most important aspect of a BAA is the notification clause. Unfortunately, it's just the reality of the world we live in. You see breaches every day. There is going to be a breach, even if an agency does everything right. What we call social engineering attacks, where someone in the agency gets a call on the cell phone and gives up their password, that's unfortunately going to happen. So when a breach occurs, timely notification is what's ultimately going to help those healthcare consumers protect their information. Agencies can then choose to put things like identity theft protection in place, credit monitoring, give tools to the consumer to help them protect themselves. But that notification piece is really key, because if they don't know about it, the first notice they're going to have that something has gone wrong is when they get a late payment on a credit card they never heard about and find out that they now have a couple $100,000 in debt that is news to them. So that's a very, very bad way to find out.
I would not like to find out that way. Here's an interesting one, JD. My practice has international patients. Do I need to worry about HIPAA?
Yes. And all the privacy laws of all the international areas you serve. Once again, not a lawyer, certainly not an international lawyer, but privacy laws are country specific. And whenever you have cross-border workflows, you've got a lot more regulatory compliance you have to worry about.
There's a lot of, I'm not a lawyer, JD. I like the disclaimers.
Yes.
We've trained you well. Here's another one. Is text messaging with clients HIPAA compliant?
True text messaging, SMS messaging, is not HIPAA compliant, nor can it be. A lot of the tools that people think of as text messaging with clients are not truly text messaging with clients. What they are is a secure app that runs on both the provider and the patient's cellular phone that works something like Facebook Messenger. It looks like a text message. It acts like a text message. It is not a text message. So there are other tool sets that do things like notifications and reminders through text message, true text message. You have to be very cautious using these tools to do things like not send PHI through those tools unless you have express written consent from the client and you're comfortable with all the regulatory burdens that go along with that. But in general, short answer, no. Long answer, no, but you can approximate a very close to text message experience with secure tools.
No, is what I took out of that. I'll go with the short answer, but yeah. I understand what you're saying. Here's an interesting one. It sounds like integration increases risks. Am I better off just using the tools built into my EHR? We all love our EHRs, JD. So
yep.
Can I just lean on that?
My short answer to that is no. Very rarely do EHRs offer the best tools to fill these niches. If they offer a telehealth solution, it's very, very, very bare bones. It's probably expensive and it's not going to do everything that you or your patients want. I would encourage you to look at tools that integrate with your EHR, but that are from reputable companies that are willing to have a deep dive into what they're doing about security so they can give you the assurances you need to know that your data is protected.
Great. JD, I'm not seeing any more questions, so we can start saying our goodbyes now. I appreciate everyone for joining our webinar today. If you have any additional questions, please reach out to us at men.com/contact. We can create a customized demo if you find out that your telehealth or patient engagement vendors are not HIPAA compliant, they're not high-tech compliant, they're not compliant in any form or fashion, and they don't have a BAA to put on top of it. So let us know. We can put it together, and JD will be part of that customized demo if it gets quite to that point. I know JD does a great job at ensuring that everyone's needs are taken care of. Again, as a reminder, if you are looking for the webinar recording or the webinar deck, that'll be sent to the email for which you registered on the webinar tomorrow. So no worries if you missed something, you'll be able to watch it as many times as you want starting tomorrow. JD, thanks again for joining me, for really doing the bulk of the conversation here. I appreciate all your knowledge, and I know that everyone else took a lot from it. So thanks again.
Always a pleasure. You're very welcome.
All right. Thank you. Bye-bye.
Thank you.